We are now back from our lunch recess. This is the Board of County Commissioners of Clackamas County policy sessions on this July 13th, 2021. Gary, you're up.
Thank you, Chair Smith. Commissioners Fisher and Schrader are at the National Association of Counties Conference and are not here today. First, we will conclude one item from the issues list this morning. That is a letter to the Oregon Transportation Commission regarding I-205 STIP amendment. Commissioner Savas, would you like to make any preamble to this?
Sure. This is the amendment that is required to recognize the funding coming in from HB 3055 and into the federal recognition under the federal guidance MPO status that Metro JPAC do, so that dollars can be expended per the federal guidelines. And so this letter is basically an advocacy letter to the OTC and the JPAC and Metro Council to move forward. So if I'd like to get an approval, and ideally if the chair could speak to the OTC via Zoom Thursday morning, that would be fantastic.
Mm-hmm. I'm going to get that on my calendar. We'll try to make an accommodation for that. Caroline's working on that, teeing me up, letting them know that I have to exit off at a certain time. Mark, do you have any comments on this letter?
No, I think it's a good idea.
Do we need a motion?
Yes. I'd like to move that we approve this letter, sign it, and send it out.
Okay, great. Second.
Motion has been made by Commissioner Scholl and seconded by Commissioner Savas that we go ahead with this letter. Any further discussion? Seeing none. Shannon, please call the roll.
Commissioner Scholl?
Aye.
Commissioner Savas?
Aye.
Chair Smith?
Aye, motion passes 3-0. Thank you very much.
Excellent.
Gary, what's up
And
next?
I suggest, Chair, you just sign the letter yourself on behalf of the Board of County Commissioners.
That's fine.
Okay, great. The first policy session is American Rescue Plan Act proposed expenditures. This is a request for you to actually spend some of the money we've already received. So we have Nancy Bush, County Operating Officer, Elizabeth Comfort, Finance Director. They are co-chairs of the internal ARPA Staff Committee. Please go ahead.
Good afternoon, Commissioners. Before we get into the policy worksheet and talk about the dollars and what we are recommending, I want to let everyone know that the committee took a look at this, and one of the things that was really important to us, because we all know that the guidance is not final yet, that we didn't put anything in here that we were uncomfortable with. We feel the guidance is really solid on the things that you're seeing here. Elizabeth is going to talk about at least one thing that is still very murky, and we know you have interest in, and she'll give you an update on that, which is, it's not very stable right now, it doesn't seem like. Just to remind everyone and the public that we have the interim final guidance, and we've identified 6 notable categories for the use of the funds, with the support of public health response in COVID, address negative economic impacts, replace public sector revenue loss, premium pay for essential workers, water and sewer infrastructure, broadband infrastructure as well. And then also an EDI lens and equity and diversity and inclusion lens should be applied to these, and then work through those issues as well. So to get started, what we has been approved by the commissioners so far is $3 million total for the public health pandemic. This is primarily for the EOC work that is still going on, and also for the work that is related to vaccine. There's other public health dollars that are coming in. The public health is also using for that, but this is what we were asked for, excuse me, out of this funding. The premium pay for essential employees is now at $3 million, which was approved by the county commissioners. And then the business support through the business recovery centers, which is $150,000, which we'll pay through the end of September. And at that time, we expect to end that particular part of the recovery effort.
Okay.
So recommendations. So first we have support businesses at $4 million. This would include child care, tourism-based businesses, farm support, et cetera. We do have another $2.7 million that came in from another funding source that will work. So that's in addition to that 2.7 that we're working on.
Where did that come from?
That came from the state, and I believe that it was also CARES dollars. And I have Allegra here to answer that for sure. Yes, it is. Yes, it was CARES dollars.
So, and the criteria for that is what? Do they apply and are they approved?
So for the $2.7 million, I believe it has to be small businesses. And Allegra, do you want to come up? It also has to, so we're doing some things with it, like that is where we're going to try to pay for anyone that is behind in their utility bills. That's going to come out of that $2.7 million. And then we're looking at a direct grant program as well.
Okay, please introduce yourself.
Yes, Allegra Wilhite, Business and Community Services Deputy Director. And Nancy's correct, we have that 2.7, and we estimate that approximately 300,000 will be to pay those utilities for folks who are back behind on their bills a little bit. We think that'll be a big help. We also recently did a grant program with some other CARES dollars, and we ended up with over 500 applications. We were able to fund 90, so we know there's a lot of need out there, and so we are anticipating using the majority of this 2.7 million to fund more of those grant applications we already received, that we didn't have the money to do so in that first round. We are also going to put a little bit of money towards the small business legal clinic as well to extend those services.
The legal clinic? Interesting.
Okay. So the $4 million that you're seeing there will continue to support businesses, but it's in different ways. For example, we could pay the fees for environmental health. So whenever they have their licensing fees that come up this year, which is in October, that's for restaurants, hotels, and pools. We could pay, part of that is like 1.2 million is what we're estimating could come out of that 4 million in order to take that burden off of those particular businesses.
Great.
But we would have a committee that would look at the 4 million and say, here's how we would like to spend that for our businesses.
Okay.
Okay?
And do they apply?
Yes, ma'am.
And what's the application look like?
So depending, Allegra, you might want to stay up here in this conversation.
We're done.
No, you're not done, so just stay
Yeah,
here.
you can just stay here for a few minutes. So you want to talk about the application process, because I know you worked on that with me,
Yes,
so.
so for the 4 million that we're looking at, we want to pull together a small subcommittee to figure out the best way to be strategic with those dollars. As we talked about with the 2.7, we know that there's more need from that first grant application. We still wouldn't have funded everyone even using the 2.7 million. So we could use another chunk of the 4 million to take care of everybody who wasn't hit in that first round, and that would be maybe about another 2 million to do that. And then for the remaining 2 million, there's a couple of different concepts that we're thinking about. Grants are certainly one way that we may go, and the application process, we could use a similar to what we've done in the past, or we could develop one that I think fits more with our EDI criteria that we've been looking at for these different categories.
So how long is it going to take you to do that?
Well, it depends. If we want to move forward with the current grant application process and the criteria that we used previously, we can get it out the door pretty quickly. We do need.
How burdensome is that? I mean, for instance, how many questions do they have to fill out, and how many hoops do they have to? I don't want it to be so. I don't want it to be so hard on them that they get frustrated, because they've gone through a lot already. But I think there's some poignant questions you could ask without being over regulatory, if you know what I mean.
I do, and we have the benefit of having worked with our partner MISO to do several rounds of these grants now. So I think we're continuing to streamline that process each time. So if we chose them as a partner to move forward with, I think we could make it nice
I
and
would only
streamlined.
like one question for me is, have they received any previous CARES Act dollars? Because I would like to be able to spread this around to people or businesses that have not received anything first.
And that has been part of the criteria before, even with the money we just sent out. What we are finding, though, is like early on, because we didn't have a lot of dollars, as you know, as our neighboring counties did.
Yes, they did.
And some of the grants were like only $2,000. So we were thinking about even making a criteria, it's like, how much have you received? If you've only received $2,000 and you received that in February or March, well, it wasn't that early because we couldn't do it yet, in the summer of last year, then maybe, they would be eligible for some dollars.
Okay.
Because because we
It's
were
hard, I
so
know.
unsure of our funding, there's been different amounts all along.
Well, I'm not going to make that decision.
Yeah.
Somebody else will have to
Yeah.
make it.
But we hear you. and have a concern about that as well.
Paul, you have your hand up.
Yeah, just a couple things. One is that, is the dollars to the businesses scalable, meaning that if they are larger businesses with lots of employees versus smaller businesses with less employees, is there scale to the dollars they receive?
So most of the dollars that we've sent out have actually been for small businesses. And has it been 50 employees or less, I think?
Yes, that's the criteria we've used.
And I think the ARPA dollars too is really targeting more small businesses than larger businesses.
Okay, so just to make my point, so if you had an employer that had 49 employees versus an employer that had 4 employees, they would get the same benefit?
That's
Yes.
how it's been previously, and we certainly could adjust a grant process. There is a balancing with keeping it simple as well, right?
Right. I appreciate the, the concerns, concern the chair raised about us getting those dollars out, but in light of some of the news articles about some of the fraud that's occurred, I really appreciate the steps and the caution staff's taken, so we'll make sure that we're not part of that news story.
You know, Paul, we might want to look at scale. You know, you make a good point. So I think you guys can develop that criteria.
Yeah, making payroll, I'll just tell you, making payroll for 40 people is far different than making payroll for 4 people.
Okay.
Okay, go ahead.
All right. The next category is support culturally nonprofits to expand capacity to assist communities. We have $4 million looking at capacity building, and then $2 million for meeting basic needs, including sanitation, food, diapers, hygiene products, outreach, et cetera. So those two go together because we will be working with our CBOs to reach out to culturally specific groups that have been impacted by COVID. They would need to build the capacity of their program, and then we would provide them with some of the items that they would be working and getting out into their communities. So that's a total of $6 million for the nonprofits and and adding something in there too for items.
What does it mean to support culturally nonprofits?
So part of the guidance of ARPA is, it specifically calls out working with communities that have been hit hardest by COVID, BIPOC communities, those that are underserved.
Economically depressed?
Yes.
That's what you mean by culturally?
There's
And
culturally.
economically, I'm just trying to get a handle on the nomenclature. So
Yeah.
economically depressed communities is a culture?
I guess we're saying it is here.
I don't know,
But
I-
it is underserved communities. And we can change that
Underserved.
language, definitely culturally and underserved communities.
Yeah, maybe so, because,
Okay.
somebody else reading that might be detoured from applying or seeking it because of the terminology they don't understand.
Okay, absolutely.
Yeah, it'd be nice to know if it included obviously, usually it's like low-income, people of color, so on and so forth. It'd nice to know exactly what that language is so that,
Sure.
we're at least informed.
Yeah, and that is definitely the intent.
Thank
Okay.
you.
Other discussion on that one?
Any other discussions on this item? Go ahead, Nancy.
Okay, great. Recovery of lost revenue, that is forthcoming. The guidance is not clear on the formula, and we seem to be, it's almost like a tennis court right now. The team's going back and forth, and I'm going to have Elizabeth cover that.
Yeah, Elizabeth Comfort, Finance Director. So yesterday, we had a GFOA conference session. Right now, for 2 weeks, we have our annual conference, and kickoff of the first day was one of these topics from Treasury with how do we handle the COVID or the ARPA dollars coming in. And there are still a lot of questions. They did communicate again that the letters going back is due this Friday, which I know that we have that letter. And a lot of feedback on the calculations. So there's a lot of pushback on how there's a calculator that has been put out by GFOA, which is the Government Finance Officers Association, because it's very difficult to use. I think Allegra can attest to that. The departments are struggling with it. One of the examples we have is we have a division that had a sale of an asset, so the loss that they were calculating was completely wiped out by the funding from that capital asset sale. And so that's part of the pushback that other communities throughout the states are pushing back as well. So there's a lot of feedback going to Treasury. We do not have a final ruling on the calculator because we don't have a calculator to identify the revenue loss specifically from Treasury, from the state. So we are waiting for that. So we have approximately, shall I share?
Sure, this is a rough number given on the calculator now, which may not, or may not be
Yeah, and-
held up, but
and-
I would share the number.
And there's differences on how each of our departments have been able to utilize the current calculator we have, but it's not complete, but we're at 11 million.
So the cost recovery is for government then, not business?
Correct. This is
Okay.
the county's loss in revenue.
And can
due
we
to
say this?
COVID.
It just says recover lost revenue forthcoming. I'm not sure who that was for.
Yeah, we can put
Government, for
government, yeah,
for
county
government
government.
agencies.
County.
County
yeah.
agencies.
Yeah.
Yeah. So in the ARPA guidance, there's a section there that is related to government and our lost revenue, and that's what this is for.
So does Clackamas County, have we experienced lost revenue?
Yes,
Yes.
That's real.
yes.
Okay, I'm going to recommend that this board, we can approve what we have today, but we need to really look at our lost revenue recovery, I believe in a priority as we do the second round. Gary, can you write that down?
Yes.
And before, any other little goodies that are
Yeah.
paid out.
Yeah,
So I
and-
did,
oh, go
I
ahead.
was just going to share, so I talked with one of my peers in a neighboring county as well about how are they addressing the lost revenues. They also have a proposal to their commissioners on uses, but they have delayed any proposal on the lost revenue due to, we need a final determination how to calculate the lost revenue, and that'll be the final piece that they'll be bringing to their commissioners as well.
The final piece.
Yeah.
Well, then we aren't going to be able to spend the rest of this 40 million, I don't think, Gary, in a timely manner until we know that piece. And then at that time, the commissioners can decide how much of the lost revenue we want to backfill, so to speak.
Correct. And then we have the second component as well, the second half of this, the ARPA dollars.
Right.
Too.
Right.
Right.
Yeah.
When the second half, you mean next year's?
Next
The-
year's.
The other 40,
The installment
Okay.
next year.
So you're asking for a dollar amount right now?
No, we are not.
No, they're not.
So you're just asking the board to prioritize recover lost revenue?
So,
No, I did.
So why is this on the list today? then?
because we don't want it lost, because that was part of the early guidance that we got from the commissioners, is to make sure that we look at to recover our lost revenue. It will be on all of our sheets because we don't want it lost. It's something.
I think
right now we
I
just-
was saying it the loudest, I'm sure.
I think it
And maybe
may
Paul
be.
was too, I don't know. or-
yeah, so really it's a placeholder in a
It is a
sense.
placeholder, and again, I don't want us to forget about it because that was direction from the board. That's why it's on the sheet.
So
even
I
though we don't
I
have
offer,
it.
it's tough for the board to make decisions because we don't know what that number is.
True.
What if it's 80 million? Then
Well,
that's
then
everything. Well, it's already 11, and we're still spending money. Commissioners, I'm just suggesting this kind of puts things on a hold, in my opinion, because you need to save, because we don't know the number yet.
Yeah, and let me share a little bit more. So this 11 million that we've roughly calculated to date is just in 2020. So they've also, in this calculator, given us an opportunity to look at 2021 calendar year and 21-22 calendar year. So those are yet to be determined. So I appreciate what you're sharing, Administrator.
I wonder if there's I didn't know that, so I appreciate hearing that. So I wonder if there's a visual way of trying to convey that on I won't say a spreadsheet, but look at those 3 years, right? And knowing that 2022 is out there, the other 40 covers all or part of that, right? But I'm just kind of really wondering so we can get a better idea of where we're headed. I understand a placeholder, but it's not a hard placeholder. It's a recommended number, the 11, let's just say. So that when we have the cumulative thing in front of us, then we can say, okay, now we have a better idea. Because, just a little bit, it's more than 11 million, because it's 11 million for hours. It's X for the business output, right? So we're already up probably in the closer to 20, and we haven't got the broadband yet.
Are you?
Or are we?
I'm sorry. Are you talking about the total of what's being asked today?
Well, just the total that we've committed of the 41.
No, we've only committed, let me see, 6,150,000.
Okay, so 6,150.
6.15.
Yeah, 6,150 is what we had, the
Okay.
commissioners have approved.
Okay,
So that's all, that's been final approved, that we are actually, and we're actually starting to pull down that 1.5 million for public health pandemic.
Okay. yeah, so and getting an itemized list of all that would be great, and just to see the running total, and you've got, so is that something different you've got?
I do have a running total.
Okay, all right,
Here's a spreadsheet.
that helps, yeah.
I can send that out. Yeah, so putting placeholders in, Nancy's going to talk about the 2 other areas that we have with placeholders that we don't know. So there are 3 areas that we don't have identified for dollar amounts. And as we talked about, 6.1 million has already been committed, and then we have potentially what we do have identified is 20,870,000.
Of all the asks that are for today.
Yeah.
So now my calculation is we're about 27 million. If we approve everything today, we're at 27 million. And then, let's say we have lost revenue of 11 million, we've almost spent everything.
The first installment.
You've
My
already- you've
recommend,
overspent.
we've overspent. My recommendation is that we are not going to allocate that today, and we can make some adjustments here in the packages, I think. But if you want to continue with your presentation, let's get through this.
Sure.
And
Yeah, so, and just to let you know, I mean, we, bringing this here today, we had a commitment that we would bring something to you by
I know, and you're
July.
doing wonderful.
So,
Go ahead.
yeah. Okay, so going on to broadband infrastructure, and we do have David Vore here today if you have questions. I know you had a conversation with him last week. So, and these are different packages that you could choose from if you decide to do so. So you were asked to see, well, how many homes would be related to what cost? For package 1, it's 4.1 million for 833, 6.1 for over 1,200, 8.1 for 1,600 homes, and then 10.1 million for a little over 2,000 homes. So that is, you would be able to pick one of those, or pick none of those, right? So those, that right there is a choice that you would make. And I'm not sure if you have any questions for us on that at this time.
yes, we might, but please go ahead and
Okay.
finish.
The clean water infrastructure, again, that is forthcoming. The guidance is very unclear on that particular infrastructure. And we do know there's other money coming from other sources for clean water infrastructure. So that is a placeholder here as well.
Do you have an amount of what that
No,
could be?
no, because we don't have any projects, Gray, we don't have anything picked out yet at this point because guidance is so unclear. It's hard to put any number to that.
Well, if the guidance is unclear, how can we possibly fund it? So I think it goes by the wayside.
Right, at least for now.
I can make that decision easy. I don't know what my
Yeah.
commissioners want to do.
If
If we don't have guidance, we can't do it.
Right, and hopefully the guidance, so when they do finalize the guidance, there'll be something in there for that. We do know that the national organizations are working on that.
Because I'm still on broadband, right?
No, we're talking
What?
about the clean water
Oh,
infrastructure.
the clean water, that's right. You
Sorry.
switch gears. Okay, yeah, okay. So do we have my question is, do we have a big need on the water part? We have identified anything on water that is a big need?
There are a couple of projects that we know that are that are working in the county. Not all of them belong to us necessarily, so they're like some of the cities, but they would cover that on their own. As far as Wes is concerned, I know there is a couple of items that they're looking at, but we don't have a dollar amount for those yet.
Okay. I would tend to be inclined to, what's clear in there, and nationally, a big statement, and we're certainly in that area, is really the broadband, the shelter, the behavioral health, I mean, all of those things. I think those are the things that are crystal clear. I think that take precedence. I think Wes is, is in good financial condition, so to speak.
Okay.
So I, just personally, I mean, unless there's something that there's, really some unique need that can't be funded or whatnot, but I think really in the COVID, being impacted by COVID and this recovery, I think that ought to be the driver for a lot of that. So I don't know if the water project is actually
I tend to
something that is
agree with
driven by.
Commissioner. I really agree with you on that. I would put water at the very last.
Okay.
I'm a big water person, so it hurts, but.
I know you are, Paul, and I appreciate that.
Yeah, I got to be honest.
And that's up next, Nancy.
Okay. The last thing we have here, programmatic coordination and support. Finance will need support to help administer the funds because we don't have enough staff to do that. $520,000 for the first year and $520,000 probably for the second year. Again, if we don't use that, it would just go back into the coffers. But I don't know if you want to speak to the challenges around in administering this much money and needing that support. No? Okay. Communications for public information, communities, including outreach materials, campaigns, et cetera. This also is looking towards some of the EDI material that we're going to be needing to get the word out. And this would be for the entire period of this grant, which runs through the end of '26, I believe, which is actually on here. Yeah, it's $250,000. So that is the end of the course, the recommended total there. We have the 6 million previously approved. And then if you approve anything today, it could be anywhere from, depending on how much, it could be just the 6 million or up to the 20,000.
Can you discuss the bullet
Or
above
20
programmatic support, reduce disparities, support hardest hit communities? Is that a funding request?
I'm sorry. Did I miss something?
Investing, no, dedicated funding to reduce disparities.
Oh, I'm sorry. Yes. So that dedicated funding to reduce disparities, support the hardest hit communities, we will take a look at that to see and how we might be able to support all of these areas for those communities for disparity. So that is not really an extra ask. It is built into our process.
So there's no dollar amount assigned with that?
There's not at this time, no.
So, on our hardest hit communities, what role does the cities have in that? Of course, they're free to spend their money how they want to. And so in our letter that we approved this morning, we have asked for emergency preparedness. We have asked for housing, and we have asked for
The
broadband. But we have broadband here. So how come if we have broadband here, we're asking for it over here?
We didn't ask, what we were asking for was that they didn't change the broadband guidance that they
Got it.
already have. Because there's limited funding for broadband, and a lot of it is not available to us because we don't qualify.
Okay. Well, let's just kind of pick this apart, Commissioners. Let's take a look at broadband. We have 4 packages. Without knowing what our lost revenue picture is, I'm prepared to do package 1 on the broadband and no more today, if we have to do broadband today.
So the 4.1 million?
833 homes.
I'm on the other end of the spectrum. I was thinking, basically, again, I was just thinking about kids, school,
Well,
and medical,
yeah,
what
well-
we've learned from this, and a once-in-a-lifetime opportunity to infuse money in this. So I'm thinking of
10.
10.
Well, the kids are going to be back in school, and Governor, hey, she's promised 5 days a week.
If I'm, Dave
I
from
know you're-
Technology Services, one thing that might help a little bit is our ratio of what we need out of this bucket versus the other 40 million. We only need about 25% upfront to get fiber and engineering going. The rest of it can come out of the next bucket, so if that makes a difference in how you want to.
What does 25% equal, Dave? How
Well,
much
well,
money?
If you pick 10 million, it'd be 2.5 million now, 7.5 million later. We could break it out. We don't need all the money today because we need to do engineering and buy the fiber for everyone else does. And then the rest of it, once engineering's done and we start actually installing the fiber, then it would be the construction piece that would fall into the next part. So it might help a little bit in the decision process, how we break up where that money would be needed.
I don't have a problem with that as long as we can add correctly next year.
So really what we're saying, if you did it that way, you're making a commitment for 2022, the $2022, essentially,
Yeah,
right?
yes.
Okay. You know what? I think that, sidebar, I think we need to focus on the businesses and the nonprofits just today.
Okay,
And I think we need further discussion on the rest.
okay.
And is that 4 million for, no, wait a minute, so, no, 4 million for businesses through
Right.
grants?
And then a total of 6 million for the nonprofits, which includes.
That's 10.
Right, for today.
So we have spent 6, 10, we have spent 16, about 16.5 million,
So,
if we allocate those today.
because we have.
I'm really concerned about the lost revenue picture.
So that's
You know, we've heard a presentation from our sheriff. Those monies won't be coming in until the end of '22. Now, not all the departments are that way. For instance, recording has seen a boom. because of all of the recording documents. So I'm assuming that Sherry Hall's department is going to be okay. Our assessment and taxation, we're collecting our taxes there. It's the same with our justice court. Those revenues are up. So not every department is going to have a lost revenue situation. And so, but not every department is going to get full recovery either. And that really needs to be, but I think there's some departments that have suffered more than others. And maybe that's where we allocate it to on a proportional basis. But I'm having some trouble without knowing the big picture of that lost revenue. Of course, we're going to continue to provide services. You know, they're not going to be maybe as robust as what we could have been if we had not gone through COVID, because let's face it, the economy was shooting out like a rocket. But I'm not prepared to do anything more than that today. I don't know, board?
Question, Chair Smith.
Yes.
On support businesses, you specify tourism-based businesses. Is that a good idea, or should we just
Come
leave it-
forward and please speak to this.
Or should we just leave it at businesses?
Allegra Wilhite, Deputy Director with Business and Community Services, and I'm going to learn my lesson and just sit here. So tourism businesses, especially in the beginning of the pandemic, were very much impacted, and that's why it had been a focus through all of our grant cycles. But as I said, we can design this according to, as we had suggested here, was maybe in terms of demonstrated need, and it may not matter whether it's tourism or otherwise. How impacted was your business? So we have methods of addressing that.
Okay, yeah, because I would think that if we specified tourism-based, a lot of other businesses might take exception to that.
Yes, and I do want to be clear that the tourism was one of
Yes.
several other
Oh,
buckets.
yeah.
So it
Yeah,
wasn't only
okay, yeah.
tourism.
Right.
They were just called out specifically because we heard continually that they were more impacted than some others, certainly.
And they were. I mean, their revenue went to zero for many, 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 many months.
So under the umbrella of hospitality, do restaurants fall under hospitality, right?
Yes.
Okay, as does tourism to some degree, not completely, because some of it's recreational, so,
Yeah, those categories aren't necessarily
right.
clean lines.
Yeah, they're
right?
not totally aligned, yeah.
Yeah.
All right.
Any other comments? I will accept a motion to support businesses at 4 million, and then there's a match at 2.7, and nonprofits at 4 million and at 2 million, and that's $6 million allocated today, 4, 8, 10, excuse me, it's 10. Do I hear a second?
Seconded.
Any discussion?
So, yes.
Yes, go ahead.
That is, so when will we come back and discuss the broadband?
I'm sorry.
When will we
When
discuss?
will we be coming back next to discuss broadband?
I
Or
guess
the next
it's-
bite at the apple, if you will?
Maybe after the final guidance is here and we have some more clarity around.
Well, we
maybe,
need
because-
final guidance, and we need to know lost revenue.
Yeah.
I don't want to
Right.
have any more sessions until we can really quantify what that is.
And that will not be until final guidance is out and we know what the formula is.
Okay.
So we know that that is definitely one that's up in the air.
Dave, has your department suffered lost revenue? No.
Not significantly, no.
Yours just still piping along? Okay, that's good to know. Mark, did you have a question?
No.
Okay.
I'm just thinking about, again, just the COVID impact of what that has done to medical schools,
Yeah.
remote learning, all of that.
All
I
of
mean,
it.
that is such a, so what do you need to prime the pump to get any of these going? Is it 25% or whatever these packages are to get something in the works?
Approximately, yes, sir, about 25% to get to the fiber, which there is a little bit of concern because everyone else in the nation is doing the same thing. And granted, that last time when we ran out of fiber, and then get engineering going, because it takes a while to do the engineering, get the permits.
Yep. The biggest thing that we were warned about several years ago, prior to COVID, was if there was a big influx of money in infrastructure or whatever it may be, just realize it'll be very competitive for the services, the people, the equipment, the materials, and so forth. So I don't want to be behind the eight ball.
Well, so Paul, you're asking us to do $2.5 million for broadband today?
That'd be my ask. And in knowing that the next 7.5 of that would come out of the next year's allocation. So it's a 2.5 plus 7.5 for a total of 10.
So is my math correct? Would that be, we spent 18 million of our 40, is that correct?
If we do
Is that right, Nancy?
2.1
Or Elizabeth, you're the finance person.
I have 15.17 or 150.
4.1.
Yeah, because we have this 4, this 2, and this 4. And then this 3.1.
8, 10, 12, plus 6 that we've already
The
spent.
2.7.
That's 18.
So that's somewhere else.
It'd be
That's
20,
not-
you would have, if you say yes to broadband, it'd be 26 million out of our 80 million you have allocated. 10 today.
Yeah,
6
but-
from last time, 10, really, you're doing 10 now, 2.5 now, 7.5 in the next year. So that's 10, 20,
But it doesn't come out of
6.
this year's pocket.
Not out of this year's,
Yeah,
but you're
right.
making a commitment. That's what Commissioner Savas just said. You're making
I
a
know,
commitment
but the
to
thing
next
is, I'm not willing to commit 10 million of that money
I see.
today.
Got it.
If he wants to commit 2.5, I'll do that, but I'm not committing the whole 10 million. And so you're going to have to figure out how you want to spend it, if we do that today.
Well, that kind of puts him in a tough spot because he wants to spend 25% of something, and if the
2.5 million is 25% of 10 million.
Okay, if that's okay, if you add that to your motion, I'll approve it. Or
Okay.
I'll support it.
But Gary has said something else over here. He said if we commit 2.5, we're basically allocating the 10 million in this year, and I'm not willing to do that.
Well, actually, I think what he really meant to say is we're allocating that much of the 80, not of the 40.
That is correct. You're not allocating 10 right now, but if you're doing the 2.5, TS is expecting you're going to give them 7.5 next year. So in essence, you are committing that amount, although the 7.5 won't be till next year's pocket of money.
Correct.
We're all kind of saying the same thing in a different way.
Right.
Okay, I just want to make sure that we understand that. So today's motion would be for 12 million. It would be, let's see if I say this right. Support businesses, 4 million. Nonprofits, 4 million. Nonprofits, 2 million. Broadband, 2.5 million. And who has done the math on that?
That's 12.5.
12.5, that's what I said, okay, 12.5. I can adjust my motion to allocate 12.5, and the next round of the ARPA money will finish the IT ask at 7.5 million. And then, Mark, would you want to second that again? If- Is that okay?
Yeah, I'll second that.
Okay. So, are we straight on that? Does it need to be repeated?
I think we got it down.
Okay.
Good job, by the way.
Yeah, this high math. 1 + 1 = 2. Okay, all right. Any further discussion? Hearing none. Shannon, would you call the poll?
Commissioner Savas,
Aye.
Commissioner Scholl,
Aye.
Commissioner Chair Smith,
Aye, motion passes 3-0. And the final instructions are we need to nail down our lost revenue, and we need to have the guidance back, and there's no need for a session or any reporting, as far as I'm concerned, until we get those back, because we cannot spend any more money until we know what we're looking at.
And we don't expect the final guidance until August,
That's fine.
just to make sure that's clear.
That's totally fine.
Okay? All right, thank you.
Thank you very much for your hard work. Okay, Gary.
All right, Mary, are you ready to go, or do we need to wait for any other speakers?
We can wait a little bit.
Yeah, if we could just wait a few minutes, Joe, Smith is supposed to be joining us, so.
Jill's gonna-
I got the first part of it, but.
We can wait for Jill. We'll get a drink of water. To the policy sessions on this July 13th, 2021. Gary.
Thank you, Chair Smith. Next, supportive housing services funds related to behavioral health services and a focus on substance use treatment services. Commissioners, you asked for this session a long time ago. Sorry it's been delayed, but this is just to update you, update only, no decisions today. We have Jill Smith, Executive Director of the Housing Authority of Clackamas County, and Mary Rumbaugh, the Director of Behavioral Health and Interim Deputy Director of Health, Housing, and Human Services. Go ahead, please.
Good afternoon again, Chair Smith, Commissioners. So as County Administrator said, this was a request like back in February, and a lot has happened, which is fine, because actually a lot has happened. So we were specifically asked to focus on initially the substance use delivery system that we have both here in Clackamas and in the Tri-County. It's sort of been expanded to behavioral health, so I'll give a little bit more definition about what we mean when we use that term behavioral health, and then specifically the second part of the ask was to better understand how supportive housing dollars can be used to support our delivery system. So I am here in my role as the Behavioral Health Director for Clackamas County, and then I'm sort of going to give the framework about what our network looks like and some of the challenges actually we have, and then I'll hand it over to Jill to speak a little bit more about the language that's in the language we have around how you can use these dollars to support specifically behavioral health. So when we talk about behavioral health, that's the terminology gets sort of thrown around, but behavioral health includes mental health and it includes substance use. And we use substance use disorder language now. We don't talk about addiction. We have, we've improved our language around making sure that there's not a lot of stigma that is attached to folks who are struggling with recovery. But specifically, it's felt pretty important to talk about substance use separate from mental health, because actually, even though as a system, as a behavioral health system, we function pretty well together between those two elements of mental health and substance use. When you look at it separately, mental health has actually historically, it's all been poorly funded for eons, but mental health actually is a little bit better supported than substance use. And so when I actually share a little bit about our network, you'll when you hear some numbers, you'll go, huh, okay, that makes sense. So, and the other caveat for today is I am responsible for our Medicaid population. So we have about, what's our current, do we have about 425,000 residents? We have about 77,000 of those on the Oregon Health Plan. So I won't be able to speak to what does the private commercial insurance network look like, because we really are supporting folks who are on public insurance, so that is Medicaid, or our uninsured population, which is actually relatively small because of previous expansion available for folks to either get on insurance through the open market or be low income, single, and be eligible for Medicaid. So I just want to also, sometimes the commercial and the Medicaid conversation gets mixed. I certainly can try to find information, but I won't be prepared to speak to commercial insurance today. So for the Medicaid population here in Clackamas County, they are enrolled with one of two coordinated care organizations, what we call CCOs. They're either on Health Share of Oregon or they are with Trillium Community Health. And Trillium is a newer provider, so they are just building up their network capacity. So I'm just really speaking to what I know about the network capacity for Health Share. And Health Share is, like Trillium, in all three counties, so Multnomah, Washington, and Clackamas. So specific to Health Share actually has 321 providers who are on contract across the three counties. Of those 321, 207 of them are mental health outpatient providers. Seems like a decent number. 85 of them are substance use outpatient providers. So you can see the difference between whether it's investment or need, and that's one of the questions that we really.
Well, which is it?
There has been better investment in mental health outpatient. And there's been previously and currently maybe a more a financial incentive to go on the mental health side, because once you're licensed, you can actually, go get into private practice, be on commercial insurance. There's a different credentialing process between substance use and mental health, and there's just sort of a less salary basis for folks who are actually serving the substance use. So I'll actually talk a little bit later about the impact that has on our workforce.
Thank you.
The rest of, so if you do the math, the 207 and 285, or 85 don't total the 321. So the rest of those providers are really what we call specialty providers. So they may be providing residential treatment, day treatment, respite, or things called ACT, assertive community treatment. So that's really community-based services for our most intensive mental health folks in the community. So as a network, 321 providers seem like a lot. So that is a good, foundation for this conversation. And I'll talk a little bit here soon about sort of how many do we actually have here in the county. It is important to know that anybody on the Oregon Health Plan can access any providers in the 3 counties, because we do have folks who work outside of our county, and it might be more convenient to, go to an outpatient provider on their lunchtime, close to work. So they're not limited to just being seen here in their own county, but it's obviously generally more convenient. One of the questions that I think will come up is, potential opportunity for developing more capacity, whether it's outpatient or a residential program, or I've spoken with Commissioner Savas before about, is there a need in this community for things like a detox or a sobering center? And those are all great conversations for us to have and really understand the needs of this community, with the caveat that any action we would take, we would be doing that in coordination with the 2 CCOs, because they would be a funder. They would be paying for the services, and with the state of Oregon, because the state of Oregon is who certifies these providers. So we don't have sort of certification ability to bring new providers on. So I'll talk just briefly about the mental health capacity. This is a significant crisis that we're in, specific to the mental health side of our behavioral health system. Since the start of the pandemic, the need has increased greatly, and you guys have actually, several of you have spoken to the concerns that you are hearing from our residents about the mental health and addiction or substance use needs that they have. This is a statewide crisis, that there is not adequate access. That has not, it's always struggled. Per rule, you need to, if you request a outpatient appointment, and you need to be seen within 2 weeks. Providers have always struggled a little bit meeting that requirement, but we are currently talking months long. I'm hearing stories of somebody calling and the first appointment is November. So that is a problem, and it's very well known all the way up to the state. This is where our urgent mental health walk-in center, what we call our mental health center, and Commissioner Scholl came and toured that a few weeks ago. Thank you for coming. We become the crisis safety net. So because we can see people same day, and we do. People walk in, we get calls from hospitals, can we discharge this individual from our emergency room or an inpatient straight to you, because we can't get an appointment for 4 months. So we are luckily adequately staffed at the mental health center. But we're not meant to be a long-term provider. We are meant to be sometimes one and done, and other times sort of short-term crisis stabilization. So we will certainly feel the pinch on the challenges that we're having in the network system, for sure. So we actually do, so as I indicated, there's a lot of outpatient providers for mental health. So we have actually an array of mental health outpatient providers, a lot of them here in the Oregon City, Gladstone. If you drive, it used to be called Western Psychological. That's one of our providers. LifeWorks Northwest, our own county providers. So we actually have quite a few providers that folks can access for mental health, including in Sandy and Estacada. And that's a pretty important need for that rural community. And folks in Sandy can also go to providers in Gresham, for example. We also have 8 mental health foster homes, 9 residential programs, and that's a combination of what we call secure residential as well as not secure, and then 1 supported, what we call supported living program called Rain Garden, and that's out in the Wilsonville area. So there's actually, again, some decent capacity and not so much access, but capacity of facilities here directly in this county. One of the questions I was asked is, what is the current need? And there's actually no easy measure or marker for what current need is. This is a complex population in the sense that they often go onto the Oregon Health Plan to ensure that they get their primary care needs met, but they don't. We still have a lot of stigma around mental health and substance use, and so the need is probably greater than we even can recognize too. But what I can share is in 2019, and these data points are important and they are in your guys' packet. In 2019, 12% of our residents on Oregon Health Plan accessed at least one mental health service, and this actually increased by 2% in 2020, which is actually different than what we're seeing nationally. Nationally, we're seeing a decrease of close to 14% of people because of COVID not accessing. I think one of the strengths of the state was we immediately allowed for telehealth, which had actually not been allowed for except for a couple of unique situations. And folks with mental health conditions actually do pretty well with telehealth. That's actually a pretty good model. So we actually saw a decrease in no-show rates because that's often the challenge in community mental health is there's a pretty high no-show rate, and you can't really, not unlike a doctor's office, you can't sort of do those 15-minute appointments. So I think we did actually a pretty good job of meeting the more immediate need until now, because now we have sort of a crisis of the access, and I'll talk a little bit about why that's happening in a moment. The other really sort of exciting news for mental health is that we, out of this last legislative session, saw the most investments in behavioral health. We had some really amazing advocates there in Salem who recognized that that we need to talk about behavioral health, mental health, and substance use, just like we talk about physical health, and that people have been disproportionately impacted, especially around these 2 conditions because of COVID. So we are seeing an investment in the behavioral health system that we have never seen before. So very exciting. Primarily that investment is actually going to be going toward mobile 24/7 mobile crisis. So that is a statutorily required activity by all counties. We are required to have staff on 24/7 to respond to a crisis in our community. And right now, because of the funding we receive, we can pretty much respond to 1 crisis at a time. I have about 16 staff covering 7 days a week. I really, for this geographic area, need it closer to 25. So our hope is that this investment will allow us to continue to partner with our sheriff's office, as well as have mobile teams go out in pairs when there is not a need for law enforcement to respond. So more to come on that. How much we're going to see, whether we have to apply for those dollars, that's still yet to be seen. But pretty excited about how the legislative session ended for behavioral health. So let's talk a little bit about the substance use capacity. So, similar to mental health, it's sort of hard to know what the right size is, but based on those numbers, you can probably anticipate we don't have an adequate network. But we actually do see better access. We see in some cases pretty much same day within a couple of days of people asking for outpatient appointments, they can actually be seen because the percentage of people accessing is a lot smaller. There's longer wait lists for substance use residential treatment, but those are not long-term programs. They tend to be 30 to 90 days, so you can actually turn over your clients, obviously faster, because they're completing treatment and going back out into the community compared to mental health residential, which can be several years long. So that's, again, sort of a big difference between the two systems. Here in Clackamas, we do actually have 18 outpatient providers, so that's actually pretty good compared to the, it is a, proportionate to the 85 total. And we also, of those, 3 do provide medication-assisted treatment, but we have no residential, no detox, and no sobering centers here in Clackamas County. So any individual who would need to access those levels of care would need to go to either Washington or Multnomah County.
We don't have detox, and what else don't we have?
Residential, substance use residential, or sobering, a sobering center, which is, yeah, it's different than detox, and I think there may only be 1 or 2. But detox.
In Oregon?
Here in the Tri-County. Yeah. So again, current needs a little hard to measure. But what we do know is in 2019, 5.4% of our residents accessed at least one substance use service, and that rate did decrease to 4.7 in 2020. And nationally, about 5 to 7% of folks on Medicaid access substance use treatment. So it's significantly lower. Substance use treatment still has a lot of stigma. It is, what is needed about substance use treatment is in the moment that person is ready to get into treatment, there has to be immediate access.
So that's, you said it's 5.4 who are on the Oregon Health Plan.
Mm-hmm.
But the rate of our citizens is much higher than that because they're self-pay and private pay.
Correct.
Do you have any idea what that number is?
No.
It's too hard to track.
Yeah.
Because of HIPAA?
HIPAA, and exactly, and then there are plenty of people who are probably just doing private pay versus, using their benefit, and every commercial insurance benefit looks different for what is covered as well.
Are you able to tell by the capacity of the treatment centers? Do we have any treatment centers in Clackamas County?
Treatment centers.
Centers for addiction.
So we just have outpatient centers, and we could easily, understand sort of what is their caseload capacity, how many people can they be serving. And I'll actually talk about a community forum I'm hosting next week, so that would actually be an easy question to get answered. So the timing of this session is actually really good in that way. So, and I do want to talk, or do want to just mention that the decrease specific to, unlike mental health where we saw an increase in people accessing, the decrease is directly related to the recovery model that works best for people struggling with substance use. Telehealth actually is not a model that works. It worked in the short term, but recovery is often that it's a lot of group work. You're in group sharing your story and getting support from your community. Mm-hmm. And so the fact that these providers have not, up until recently, been able to actually provide face-to-face or in-person services, we actually saw a lot of people leave treatment, and that is, or not engage in treatment because they couldn't actually be in community with one another. So I'm hopeful that as these restrictions have been lifted and people can safely go back to face-to-face and to group treatment, that we'll see this, ability for folks to feel more comfortable accessing. So that, again, is sort of the difference between the two systems. We saw telehealth work beautifully in most cases, not all cases, for mental health, not so well in substance use. And we've heard some pretty sad stories of people who were 14, 15 years in recovery and who are back using because they lost their community. It's really a community type treatment model. The other sort of current state of funding, as you all are aware, is there will be some new investments in substance use treatment, sort of yet to be determined through Measure 110. Those will be, competitive grants that certainly the county, both our own health centers will be looking at, and we would certainly be supporting and partnering with nonprofits who might be interested in applying for Measure 110 funds. So more to come on that. We don't. I know that there was an early, or this last spring, there was a RFP that went out through the state with some old dollars, and we don't yet know what the new dollars will look like. So some opportunities certainly for some future funding on the substance use side. So as I've indicated, one of the, what I would consider a new development, had I come to you guys and had I come to this board in February, March, I probably would not have been having this conversation, but a pretty significant new development is that we are struggling to maintain our behavioral health workforce. The last 18 months has taken a significant toll on this workforce because they have continued to provide services. In particular, this is a statewide crisis. In particular, this is true for our staff who have been providing crisis services because they were continuing to do that face-to-face in unknown, unprecedented circumstances.
So you're saying they're burnt out?
They are burnt out. For example, the state hospital and has their workforce has turned over. Their workforce has gone out on leave. Their workforce has quit. They needed to bring the National Guard in to actually help staff the state hospital. So it is a crisis because we struggled probably how best to support our own workforce, and I'm saying we as a statewide,
Sure.
Statewide we. And I think the other challenges across the state is it's been difficult to recruit staff to come to smaller communities where cost of living is pretty high, but salaries are low, and so people can't even afford rent in those communities. So it is a significant crisis that the state is in that we are speaking to, obviously, the Oregon Health Authority, who's also speaking to the governor's office just about what would it take to either retain or bring back the workforce. And I highlight this because this conversation will be a balancing act of increasing capacity or even building out a network. But if you don't have a workforce to staff it, then it's this catch-22.
It's like opening a restaurant with no waiters.
That's correct. And we're seeing it all over, correct? Everywhere you go, people are trying to hire.
Do you think, given some time and rest, that these mental health providers will want to come back?
I think that they will. Some of the strategies that are being talked about both at the local, when I say local, it's with our 2 CCOs, as well as at the state level, and I'm lucky enough to be in a role where I'm asked to come to the table for both of those conversations. There will be certainly an investment in looking at how to, pay these folks. I mean, many are paid, more than a living wage because they're licensed individuals. But again, the burnout has just been really high. So what kinds of incentives, loan forgiveness, and so I think in the short term, the money could bring some folks back, but longer term, I think we have to really look at what's sort of burning these folks out.
I had a conversation over the weekend at a retirement party, actually. So, retirement party, there were a lot of medical people there who were exiting out of the nursing profession. Mm-hmm. And there were some young people still in the nursing profession. And we're seeing the same effects there.
Yep.
And that's very scary.
Yep.
And, a couple of these nurses were supervisors, and they says, after a 12 and 14-hour day shift, I just can't do it anymore. Mm-hmm. And they really gave everything they had. And then the new people coming on with families, children at home, so we really need to start rethinking how we use our workforce in the medical and the whole broad array of the medical field, and I don't have an answer to that, but it's sad.
Yeah, and I thank you for bringing that up, because I think we are seeing that also in hospitals. Nurses, folks are they're just done, and I think they have led us through an unprecedented time while also struggling with their own mental health or emotional health, struggling with trying to keep their kiddos grounded as they can. Many of us are trying to find our footing, as we emerge out of this. And so, one of the things that I've said through all of this is if there's one thing I hope out of this pandemic we can do, and I think we're doing it with a policy session like this, is to highlight how important it is to talk about substance use and mental health. There is so much stigma to these conditions, and people are not getting the support that they need. And yet, as I've indicated, if we open the doors but we don't have a workforce to support them, then that becomes a problem. So we have to be able to take care of our own workforce. And I share a story when the pandemic first hit and we were closed, but my crisis clinic was not. I moved my office, for lack of a better term, location down to our mental health clinic, because it was important for me to be there with our staff who were doing this work. And after about 4 months of being there every day, I would show up and I would it's like, why do I feel like this heaviness in my chest? And I went for a walk one day and I was like, oh my gosh, this is anxiety. I don't suffer from anxiety. Sure. I don't suffer from depression. There's nothing wrong with it, but I didn't even as a mental health professional, I did not know what was happening.
Didn't recognize it.
I did not recognize it myself, and that's what's happening to our workforce.
Statistically, I think probably every person in America has suffered one or both of those at some point in their lives.
Mm-hmm.
And why, don't be ashamed of it.
No, absolutely not. And so this is our opportunity to say, there is support. And so that's, the importance of what we do here at the county with our 24/7 crisis and support line. And we during this pandemic, changed our name to Crisis and Support. We didn't want somebody to feel like they had to be in a crisis. We wanted them to know that if they just need some support, in those early days, we're hearing from loved ones who are like, I have never had to stay in my house with my children and my spouse, and I do not know what to do with them. You're right. I mean, all of that was so unprecedented. So even the types of calls we received were very different. And so just being able to provide that support is really critical. And so we have to be very aware about how am I taking care of my workforce to make sure they're not getting, burnt out as well. So I just, I don't have all the answers either on what to do about the workforce shortage and people exiting, but I am pleased that I am asked to come to the table to help problem solve both locally and at the state level. So I will be doing that. So one of the next steps that is going to happen specific to the substance use delivery system, and so I'm going to be hosting a community meeting next Tuesday, Wednesday, the 20th, July 20th. All of our outpatient substance use providers who are here in this county are invited and have accepted, as well as several of our peer-run organizations. So one of the things we invest really heavily in is our peers. So these are individuals with lived experience themselves, and we call them peer recovery mentors.
Like AA, for instance, is that one of those?
Yeah, that we have. So you guys actually approved some of those contracts today, actually. So these are folks like Folk Time and so they and they're a really critical part of our delivery system, because sometimes somebody who may not be ready to go actively into treatment, they can work with a peer and just have that person walk alongside of them. Can I take you to an AA meeting? Can I invite you in to get ready to participate in treatment? So I'm going to be hosting a meeting with many people next week, and really just do a level set. What are they seeing? I feel like I understand it from sort of a data and systems piece, but I really want to hear from the folks who are doing this work directly. Who are the folks coming through their door? Who are the folks not coming through their door? And where do we have some gaps in the delivery system? So if applying for these funds or getting these dollars, there were no barriers. Like, what would this county need to meet specifically the substance use needs of this community? So I'm excited about this conversation. I think I'm going to hear more than is humanly possible, but that's okay, because then I think we can really, talk about how do we begin being very systematic and thoughtful as dollars become available to think about how do we build capacity. I will be also asking them directly, what would it take to retain your workforce or bring new folks in? Because I think we need to hear directly from them. Is that increased salary? Is that increased benefits, increased leave? Is it signing bonuses and people commit to 2 years? Is it loan forgiveness? What do they, from their perspective, what would it take to either bring in that new workforce or maintain the current workforce? So that is what I have.
Thank you, Mary. Paul, you have a
Yeah, well, I think we saw when there was a nursing shortage, really, the supply and demand and the pay went up eventually. So I'm hoping that in the mental health arena and the substance abuse arena, that same thing happens. And I think the case we heard in one of our listening sessions, I can't remember exactly where we picked it up, was that the education required for all that is so expensive, and yet the pay is not commensurate with paying the loans, for example, or
Correct.
living. So it has to be a living wage, a living income, in a different context that we normally talk about it.
Yeah.
And so I just don't know if those market pressures are there yet or if the dollars are there to provide the market, the pay.
I completely concur. In the last two sessions, both the previous short session and long session, I have had the opportunity to testify. It's often the Behavioral Health Ways and Means group. And what I remind them is that, I have a county financial assistance agreement with the state of Oregon for our uninsured population for the most part. And when they continue to provide me an annual or biannual contract that is flat, that is actually a loss because the cost of living goes up, the cost of services go up, and so I either need to pass that lack of increase onto providers to keep them whole, but then, run into potentially deficits. So, this idea, they're like, we haven't reduced your revenue, but if you don't increase it even to address the cost of living, that flat revenue is a decrease in revenue. And so they don't like when I say that, but I always feel, and I'm very polite when I do, but I feel like it's important for them to remember that. And so I think, we do know that a better market study of, different, classifications of employees, because you do want to fund your licensed employees or salary them higher because they have, credentialing requirements, just to keep your license, every 2 years is several $100s. And so how do we also incentivize keeping, folks if we're able to actually offset some of those costs. So I think there's a lot to learn from some of those challenges that the nursing community had as well.
So just one other thing I want to touch on, and that is is there any sense of momentum on detox centers? Sobering centers, whichever. I know they're different.
And I'm not an expert to speak to that. There is, through some of the funding that we're going to see that is going to expand 24/7 mobile crisis, there will be an ability to consider applying for funds for a couple of different levels of care. Detox is one of those. Crisis Stabilization Center, which there are only a few across the state. These are centers where somebody could actually, and primarily mental health, you'd be able to sort of keep them stable for 23 hours. We have an urgent mental health walk-in center, but we are not obviously 23 hours because that's a pretty expensive model. But that is going to be something we're interested in pursuing, as well as detox. And it's yet to see what are the parameters, how much is the money going to be adequate and sustainable for programs like that. So there is some expansion capacity with some of this legislation that was passed.
Yeah, I thought the one that was unique to me was that Salem Mental Health facility they had over there, and I think the stays could be up to in extreme circumstances, 10 days, but typically a few days, 24 hours or a few days. So that was, it was, and the turnover, it was always, apparently, they're full all the time. So if there's, as soon as there's an empty bed, it's filled right away.
Right. Deschutes has a new crisis stabilization center that I think the Sheriff's Office and I are interested in going and touring and understanding sort of what it, because they also did partner with their Sheriff's Office to really use it as a diversion from jail as well. So I've been talking with them about looking at that, let's not create the wheel. If there's some good models out there, then let's certainly consider those. So.
Great, very informative, thank you.
We transition to the next part. The timing for this is good and bad. We had hoped that when we'd be talking about this, we'd have money to invest in some sort of behavioral health treatment or system, and that's yet to come. So maybe that's a good thing because we can do this more thoughtfully and carefully. And it's very timely as well because I recently had outreach from the mayor of Oregon City as well as Mayor Gamba in Milwaukee, both of them wondering if they could access supportive housing dollars to help their police forces who are spending the majority of their time working with often homeless people with severe mental health
For their
crisis.
police. Wow.
So, and I mean, Mary's very familiar with that.
And
So-
you said what?
We said that yes, that would qualify, but there's also another alternative, and that is the fact that once we do get this funding coming in about a year, we're anticipating, we'll be able to actually invest in an outreach system where you have outreach workers working with folks who are homeless, who have these issues, that have behavioral health experts on their teams, so that when the police do run into somebody, not only do they have embedded folks on their teams, like Clackamas County Sheriff's Office does, but there's a resource for them to call immediately and have somebody show up and have housing for them and services. Right now, when they run into an issue, they have someone to try to interact with, deal with appropriately, maybe put in jail, and then they go right back out. And there's just no solutions, and it's very frustrating and very demoralizing for the police force, who really wants to help. So we told them as soon as we're ready to push out an RFP and we have funding, we will contact them, but we really need to work on a communication system so our police forces know who to call, and somebody's there in 10 minutes to help them link these folks to the right services. And so I just wanted, I mean that phone call was literally with Mayor Gamba at 1 o'clock, so it's very timely. I wanted to just let you know that these services are eligible and are a priority in our community. All of the community engagement work that we did, this was one of 2 top priorities, that and shelter were the 2 that all the community partners and homeless folks and people in poverty named consistently, which is really interesting. Our requirements with this funding, which is coming, is that 75% of the funding serves people with disabilities and people who have addiction challenges, qualify as being disabled, who are experiencing or at risk of experiencing homelessness and have extremely low income. 75% of the money goes there. And the other restriction is 25% of the money goes to folks who don't necessarily have the disability but are having challenges with homelessness and are also low income, not extremely low income. And we have to track those things and report on those. And the key is that the folks are placed in housing and that they stay housed. So I think these services are absolutely essential. A conversation we're having with Multnomah and Washington County regularly, and it's actually a debate, is should we be investing and using this amazing new resource to pay for these services, or should we be solely relying on, the health plans and the federal and state funding that is in place? And Washington County at this point is adamantly against using this new resource. They want to pair it with existing resources. And Multnomah County is at the point where they think they need to do both because they're just not getting the outcomes that they need with existing resources.
But the difference between those counties is really apples to oranges.
Yeah, I know.
Because Multnomah County's mental health outreach and programs are they're the best in the state. Am I correct in saying that?
Significantly more robust
More
than the other two counties.
Yeah, and that particular commission spends a lot of their time doing that, probably more than any other,
Yes.
I think, county commission around.
I agree, and they invest more in homelessness as
They
well,
do.
and they're still considering using this to fund mental health and
So you're
treatment.
pointing that, you're talking about the $110?
Supportive housing money.
Oh, the supportive housing.
To
dollars, okay.
actually pay for providers, because they're just not getting the results that they want to by using, the existing funded.
And then when they need to go find providers.
I know,
Like the
that
rest
is,
of us, right?
that is another conversation that we're having with providers, is they are saying they can't retain their workforce, and we need you, they're saying counties do a study on what providers need to retain their workforce and pay us what we need to keep our folks. So all of these conversations that we're having is really interesting, align exactly with what Mary just reported. The issues overlap tremendously. However, not everybody who has, behavioral health challenges is also homeless. So the new supportive housing funding can be used for all these services as we in our county think is appropriate, as long as we target those services to people who have housing challenges, and we can report on those. And maybe that's investing in outreach and tying that closely to the police force. I'm hearing that more and more. I know it's working with Mary and Deborah Cockrell to align our services with the health centers, and we've already got some pilots planned to do that work. We really need to work with existing programs to enhance them, not try to replace them. And the other thing I wanted to really focus on is the fact that right now we've got a rent assistance program that Kaiser and HealthShare are paying for. It was a 1-year investment in rent assistance for senior, disabled, homeless folks. Clackamas County is housing about 120. And all those people had to sign a release of information, so all their health information is being tracked. And we'll track them from the time they're placed for 2 years. And we're hoping that the Medicaid system and HealthShare and these other systems will see this tremendous difference in cost to help pay for housing. As a health care measure, we know that it's an indicator of health. You have to be housed to be healthy. And that more funding will flow to help with housing as a result. So we're actively engaged in that. And that's a tri-county regional initiative as well. And I think those were the main points that I wanted to add to. Are there questions related to that? We have time to plan.
Yeah,
Oh, go ahead.
I have a question. So you kind of said it, but I'm going to say it a little bit differently, or maybe ask the question a little bit differently, and that is that I had a conversation with someone recently, and I think the assumption was that the mental health services we need or are being provided are specifically for the homeless community, and that's not true, right? It's a broad spectrum of everyone, right, that needs those services. And so if there is a response team that responds to a mental health crisis, and we don't know their status, right, whether it's the Milwaukee Police or Oregon City Police or Clackamas, and they're on site addressing someone in a crisis, obviously those dollars will be billed to whichever the appropriate group is, or not a group, but funding stream, right? So could you tell me a little bit more about that? Because I think I kind of want to understand that better, these response teams in particular, how that is that really not a big deal? Or how do we do that in a way, because it seems there's so much demand, and I think crisis is a crisis. You're going to respond there. We're not going to make a call as to what their status is. We're going to treat that person, right?
If I can maybe start with how it works today, because I think we can actually build off some of those lessons learned, and that your question is really critical, because that's part of the conversation that's happening at the state level, with some assumption that if we are out, whether we're partnered with law enforcement or our two-person team responding to a mental health crisis, whether that person is houseless or not doesn't matter. We are not, the Medicaid requirements to actually bill for those services require us to actually do a full assessment. You're not doing that in the field in Welch's. Not happening. So we've had to work really hard with our coordinated care organizations, and they've been an amazing partner to say, really, how you have to fund us is you have to, just like you do fire and police and EMS, you have to pay for us to be available waiting for that crisis to happen. So to ask us to sort of be reimbursed after the fact is really an impossibility, because I still have to pay for these folks to be working 24, they're not obviously working 24/7, but a team working 24/7. So really what you have to do is you have to pay for our capacity, and just like you do in other, immediate response. And there's been a challenge for some state folks to really wrap their head around that, because, a crisis might not happen at 2 a.m., but when it does, you certainly want the response team out there. And if you're going to statutorily require us to do it, then people have to be able to be paid. So I think there is an opportunity to do both some education about what would a response team look like. And for me, my 24/7 response team, it does not matter your insurance type. We don't ask your insurance, because, again, we're not going to go seek reimbursement for that, because we're already funded through a couple of different revenue sources to have this team, ready to respond. So I think we have to think a little bit about how sort of that front-end investment can happen, and making sure that if these dollars would be eligible, how do you really sort of tell the story, justify it, and then do good data collection. One of the things that I think behavioral health in particular struggles with is really telling our story. People hear about the not great outcomes, but we do not do a great job of telling our good outcomes. And part of it is because, people's treatment is confidential. But we can really talk about the expertise that we bring to address the needs of this community without, disclosing, people's protected health information.
Okay, so I appreciate that. I'm going to look to Jill, because the way the language I've seen with the contracts for the $26,210 seem to be on audit and seem to be on, appear to be on a reimbursement or some kind of legit, how would that work for the SHS dollars?
Right, they definitely are on reimbursement. And I'm speaking before an IGA is finalized. So all I can do is speak to what we've discussed and agreed on verbally, and that is that we will be measured based on placements and retention and housing, and how we get there is our business, because every county has their own challenges. So we've been told, if your county needs to invest in community outreach, because we have literally almost none in Clackamas County, none. I think we have one worker that does community outreach. If that's what we need to link with these behavioral health services for folks who are homeless, if we can see success through that contract and we track it internally and reimburse for those constant teams to be available and it's working, we can keep doing that. We're supposed to be testing things and seeing what works. And, that's what we're intending to do, and outreach is one of our priorities for the first year that we receive money.
Okay. So this morning, we talked about in our letter for the ARPA guidance, for a shelter, and I think a shelter could be a transitional type of model. So, Mary's team would respond, it sounds like. We would respond, or SHS HAC would respond with a roof or a shelter, whatever it may be, and transition into something more permanent. Is that sum it up?
Certainly
could
be a model.
Shelter is all about transitional. It should never be permanent. I mean, I think we've seen that work at the Vets Village.
Right, okay. All right, always 10 years now, still trying to wrap my head around all this, so I'm always learning.
Yeah, I think we all are.
Yeah, I was going to say, 20 years, sir, and you and me both.
Mary, your employees are all county employees?
Correct. Over at our mental health center, they're all county employees. We don't contract out our crisis response. Other counties do. Washington County, for example, contracts with LifeWorks Northwest for their service.
Gary, on the ARPA critical performance bonus for you people, can I give them
Correct.
a pat on the back?
Yep. Yes.
Most of her employees, the crisis employees will
Yep.
definitely be eligible for that, yes.
Yep.
Yeah, this has been just really informative. When I was in the legislature, I was on Human Services, and we heard a lot of mental health. And we've come a long ways since I was in the legislature. My first session was 2001. And then the big deal then was, will insurance pay for mental health treatment? Do you remember that?
Mm-hmm.
Parity. Mental health parity in insurance.
Mm-hmm.
That was such a that was not then. Then it wasn't that way.
Mm-hmm.
And so we just take that for granted now. Well, of course we're going to pay for it. So as we keep pushing and pushing and pushing the envelope, it's important, that there's advocates like you two doing that to help form the policy to go forward. But like you say, the costs and the needs are out of the sight.
Mm-hmm. More so, I mean, we've always known that there's more, demand than we have capacity, but more so now than ever. And I think it's, if this crisis highlights the urgency, then so be it. I certainly want people to receive services when they need them, but.
So a question for both of you. Do you think the COVID pandemic has exacerbated the mental health systems? Are more people in mental health crisis? Are there more people in substance use disorder crisis because of COVID? Can you get your hands around that?
Oh, I 100% can tell you that's absolutely correct. We're seeing folks who never accessed behavioral health services ever. Because for our most in need, our folks with chronic mental illness, our folks with significant substance, we already had our arms wrapped around them. They were already in services. So who we're seeing are folks who have never navigated this system before. And it's directly related to worries about COVID, job loss, stress of children, economic loss. It's the full picture.
And instilled fear, I think, is a big part of that.
Oh.
Yeah, I can tell you at the Housing Authority with all of our residents, we relied heavily on Mary's teams to come because of tremendous increase in domestic violence and neighbor on neighbor, fighting and just mental instability because people are all cooped up together, can't go anywhere. It's a lot of stress.
Interesting.
And then I think you layer on our firestorm, our ice storm.
Correct.
Yep.
And all of that combined, that maybe, I just wonder if there's any data or comparisons looking at here versus areas where they haven't incurred that, just the
Paul,
COVID.
I think we had that bump for us when this board got over 630 emails in a day and a half about the fireworks ban.
Yep.
And I believe that was organic. I don't believe it was a contrived or political movement. Those people, when you read those emails, those people, that fear was real. I've lost my house, or I had to evacuate, or can we not exacerbate this really bad situation further? And that fear is real. And it's going to be around for a while, so we'll just have to manage our way through it.
Yeah, and we are lucky. So when the pandemic first started and the emergency operations were set up, I was able to advocate that we have a pretty strong behavioral health arm to that, and we lifted up what we had called our behavioral health go teams. And you guys have heard some big success stories, and that was the team who was actually responding to the Housing Authority. And then the state of Oregon did apply for some FEMA funding for a very similar model. So these are not clinicians per se, but they're staff who are trained in psychological first aid, because often folks who are in that sort of emotional crisis, they just need that soft touch. They need somebody to give them some water, check in with them, what do they need? And we were able to redeploy that team during wildfires, so they went to all the evacuation sites. Less during the ice storm, because that was, somewhat short-lived, and just the safety of those folks traveling. So that program is now called Safe and Strong. So you probably have seen some billboards, you probably have seen some ads, because across the state, several of us lifted up what we call Clackamas Safe and Strong, and then some of the ARPA dollars that you all have approved for public health and behavioral health will continue to support the Safe and Strong teams for us to go out to individuals or to groups of folks to continue to provide that support, and that's that linkage opportunity. So because we absolutely know recovery from this regarding behavioral health will actually be long-term. People will get back to school, people will get back to their jobs, but the emotional impact will be long-term. And so luckily, the state is recognizing they were able to get a no-cost extension of the FEMA grant through the end of the year. And then we'll be able to use some of the ARPA funds to keep that team. We'll shrink a little bit. We won't have as much demand, but we will continue to provide community outreach to really the hardest hit areas. So.
Any other comments from anybody? Mark?
I have one question. If you had one wish today for a relatively short-term action that helps you, what would it be?
Oh, it's
Something
my
that
magic
the county could do.
my magic wish
I'm not
list.
talking about magic, no. Don't go that far, but what would it be, the first thing to benefit your organization the most?
You know what? This conversation benefits me the most in the short term. I think the awareness piece is critical. When we name it, when I share my personal story, which I have not shared with many, but when I do, somebody always calls me up and says, oh my gosh, thank you for sharing that story. Because I was struggling and I didn't know what that was. So I think in the short term, this conversation is critical because then as we say, gosh, this is how we'd like to invest new dollars, people are like, oh, I know someone who could benefit from that. We're all in this together. And so we are going to have to get creative because, again, I think the need is greater than the current capacity, and it's going to take a lot of work to build. Frankly, the reason Chair Smith, when you were in the legislature, the model was very different. You had a little bit of outpatient, and then pretty much we institutionalized people.
Oh, huge.
That's what we did. Well,
Everything
now
was-
it's flipped.
Yes.
But you again have to have the workforce. You have to be able to pay people well, and that's the right thing. We absolutely should be keeping people in the community, but it's a lot of work to do that. Building brick and mortar is an expensive model, which is why we've tried to be much more community based. So we try to really go to where people are at, especially the most in need. So there will be continued opportunity, but this conversation is critical just for awareness.
Well, thank you both, and I'm glad you're working at Clackamas County. I look forward to a very long association with you both, so don't go anywhere. You can go to your offices.
This one actually is not going anywhere because she's up
She's
next.
staying here too. I asked her to. We have one more presentation for you.
We certainly appreciate your time and
Yeah.
great conversation.
Yeah,
Okay, Gary, up next.
Are you ready for the next session, Jill?
I am. I'm ready to jump into this, and this
All right,
is just.
I'll introduce you, please.
Okay.
All right, so next, you are now sitting as the Housing Authority Board of Clackamas County. This is Housing Authority 101. You also asked for this about 5 months ago, and unfortunately, due to many other issues, we had to reschedule consistently. I'm sorry about that, Jill, but thank you for being here today. Jill Smith, the Executive Director of the Housing Authority of Clackamas County, will present. No decisions today, just a briefing.
And I'll say before you get started, Jill, our other two commissioners who are probably on an airplane can go back and listen to this, and I'm sure they're very interested in it, and they probably will.
Good,
So,
that's great.
yeah.
And I'm always around for questions,
Right.
too. Welcome them.
So one small point of order, is Commissioner Leenstra with us?
Oh,
I was going to
yes.
ask about that.
Is she planning on attending?
She should have been notified.
Okay.
and planned on
I'll look and see if
attending.
she's in our meeting in the audience, or maybe,
Yeah, I don't have that online, Paul.
yeah, I've got to, maybe,
We haven't really set this up for for people to comment on Zoom, so
yeah,
But she
true.
can listen.
she can listen.
Well, maybe we can let her know that this happened and she can listen.
She is in the audience,
Oh, good.
okay, so she's listening.
Okay. Great, thank you. Go ahead, Jill.
The main purpose of this briefing is just, as our elected body changes, we want to make sure that you all know when you sit as the Housing Authority Board, kind of what that means. So for those of you, Commissioners Havas, that have been doing this a long time, please bear with me. It's just a high-level overview of what a housing authority is, what the mission and purpose of a housing authority is, and why Clackamas County has a housing authority. So when you sit as a housing authority board, and Ann is part of that. Hello, Ann. I hope that you can hear me clearly.
I can hear you clearly, thank you.
Oh, she can participate. Thank you, Ann. The purpose and mission is basically to assure that low-income people in Clackamas County have access to affordable housing. And when I did a bunch of research just out of curiosity, and on May 4th, 1938, the Clackamas County Court unanimously approved a resolution stating that the county was in need of a housing authority due to unsanitary and unsafe inhabited dwelling accommodations within the county and a shortage of safe and sanitary dwelling accommodations available to people of low income at rental rates they can afford. So I thought things have not changed much, have they?
No, they have not.
The county deemed it necessary, and we talk about affordability all the time, and I think it's kind of a confusing concept because there's so many people at different income limits out in our community and so many that need help. So I chose to attach to this packet, the very last page is a handout that I would like to kind of familiarize you with and encourage you to reference when we're meeting. And I'm going to be asking my staff as they present to you to always include this because I find it extremely helpful, and I think you will as well. Every year, HUD updates area median income limits. Can you all see this chart? Can you all see it? Very last page. And those are published for the Portland, Vancouver, Hillsborough metropolitan area. And they're based upon a family of 4, and then there's a math calculation that pushes it out all the way from a studio to an 8-person household. And the median area income for Clackamas County as of April was $96,900 a year. Wow, it has gone up tremendously.
That's a big jump.
I know, I was very surprised. And then it shows you by household size. So when we talk about families earning 30%, they're called extremely low income. These are basically the folks that Housing Authority helps. About 85% of the folks we help earn 30% or less. But we can help, as a housing authority, folks all the way up to 80%. So when we talk about these income limits, I really think we need to have that chart in front of us. But what I find even more helpful for me is if you jump down below, HUD and our country, and the state, and all these funding resources for housing deem affordability, like you can afford your unit and your utilities as long as you're not paying over 30% of your income for rent and utilities. That's what you always hear. So when the state issues their reports on rent burden and they impose, like cities that are rent burdened are required to have all these meetings and do all of this different work. Gladstone and Oregon City are both engaged in that right now. They're looking at this information. So somebody that's a 3-person household, if you look at the bottom chart, that qualifies, let's say they qualify for a 2-bedroom, and they have 3 people in their household, and they earn 30% of area median income. The most they can pay for rent and utilities is $652 for it to be affordable to them. So as we look at what we're developing, what we're subsidizing, what the rent needs to be set at to get the population in that we want to serve, this is very, very helpful. So I just wanted this to be a reference. And this kind of helps us to understand, like when you went and you toured Rosewood Station, all those units have 60% rents. So if you look at the 60% column, if it was that same family that had a 30% rent threshold of $652, those rents are probably set around $1,200, for that unit. There's no way they would even qualify to live there. They couldn't even move in. So the only way we can serve folks at that lowest end is with additional subsidy from the Housing Authority, like a voucher, or subsidy through the new measure funding. So it kind of, for me, it's an eye-opener when you look at it this way. So I hope you guys find it helpful, and we'll keep referencing this as
It's
we
just frightening.
I know. That's why there's so much homelessness.
Yeah, it's totally frightening, and there's so many people that are just living on the edge. They're gonna, if you fall behind, you can't get caught up, or you're not sure if you're gonna be able to make your rent, and you have the kids, and you wonder why we have mental health.
That is one of the main reasons. If you weren't having challenges with behavioral health before you became homeless, it wouldn't take long.
Can you imagine the anxiety level?
You don't have anywhere safe to be. For me, that would be, you don't have even a door to shut to feel safe to go to sleep if you're homeless. So that would be very stressful for me. So I hope you guys find that helpful. We'll keep referencing it. And then Public Housing Authority is actually a separate public corporation with separate powers. So I decided I wanted to do a little research on that too and try to understand exactly what does that mean. And what I found is that the reason that they named it a public corporation is so that it can do the same work as another corporation, but be more nimble. And they also removed it partially from the government, so it's not part of government, in hopes that it will be more nimble as well and be able to partake in this work that is so important and necessary for the community. So while it is a separate entity, a lot of times the Housing Authority will be tied to the government entity through its board, like we are, and also through contracts that enable it to operate without having to focus on things like HR. Like the Housing Authority has a contract with Clackamas County to do its HR work. That enables us to not have to focus on HR, but do the work of housing. That's an example. The programs that we administer, most housing authorities are moving more to be rent assistance and service contract administration agencies over and above all else. Many of them are moving away from being in the public housing industry because the United States government has done such a poor job on that program. If you look at public housing across the country, where and how it was built and how people were segregated and separated, and the projects, and just look, I'm not a big fan of public housing traditionally the way it was built. If you look, for instance, at Clackamas Heights, when it was built there, look how isolated those folks are. How can you get access to a job? They are near one good elementary school, but they're not even close to, a good store, really. Transportation, they're very isolated. It just puts one more large challenge on those folks that are already really challenged. And another thing that has really changed since the inception of public housing is who we're serving. It used to really be a step-up program, short-term space for people to invest in school or education and get on their feet and move on. And now with the aging population, really the majority of the folks that we're helping are disabled seniors that won't move on until they pass away. So our waiting lists are stagnant. It's not the program that it was originally developed to be. We're helping really vulnerable people that are in that 30% of area median income column. So a lot of times people think, move on, let's help the next person on the waiting list. And it used to be the average time to be on housing was 7 years, and it's much, much longer than that now. As an example of that quickly, the Housing Authority opened its waiting list on June 15th of last year, and we were open for 3 days to June 18th, and we received 13,578 applications. So if that's not an indicator of need, I don't know what is.
And Jill, and how many were those applications you were able to fill?
We actually did a lottery, and 1,200 of those lucky people got to go on a waiting list.
So less than 10%?
Yes, and those lucky 1,200 get to wait for 2 to 3 years to be served.
Oh, my gosh.
Yeah, so
So it's not that they even got housing,
No.
they're on an expedited wait list.
they're on the long 2 to 3 year waiting list. They're the lucky ones. So, and that really is a true indicator of need, that a lot of folks trying to develop affordable housing, a lot of development agencies call us and ask for that data to show need. The powers of the Housing Authority are cited in ORS 456.120, and I wanted to list those for you. And they're really all focused on the nimbleness that the state tries to grant to an agency to help the county to develop the needed housing. Because while there is I'm a huge fan of housing choice. I think the Housing Choice Voucher Program is my favorite program, honestly, because I think people should have the right to choose and the ability to move near work, near childcare, near their mother, and be part of the private rental market. But if there's not enough units that are available for rent, it won't work. So we really have to balance what we're doing. And that's why when we talk to you soon about the redevelopment of the Hillside Park, we'll be asking you to allow us to project-based vouchers in some of those units so that the low-income people that live there now, that's the only way they could afford to move back, is if we took some of those subsidized vouchers and attached them to properties. But then you eliminate their ability to move. So there's give and take with it. The way that I've always tried to think of that is the Housing Choice Voucher really should be project-based if you need to provide certainty over choice. So certainty of a unit might be needed for somebody who's highly disabled, maybe homeless, who would not compete well in the market.
And who are not employable.
Yes, exactly. On Social Security, a senior who can't make rent.
On these 1,200 vouchers, are those people employable?
There's a real mixture. I would say probably the most of them are senior disabled people.
Okay.
But I actually have that data if you'd like to see that.
I would assume that was it.
Yeah, I think it's about 60% of them are senior disabled. So some of them are, and if we have the opportunity to apply for what HUD calls moving to work flexibility, which is something that I'm hoping that we do have the opportunity to apply for and the capacity to do it, it allows you to create programs for work-able families, things like time limits and work incentives, which really is the only way that you get movement in a voucher program. But you have to seek special HUD flexibility to do that because it's against the HUD regulations. So, but work requirements have been proven to be a really good thing for work-able families if you invest in their development and help them transition.
Right. If Martha was here, she'd talk about the workforce development.
Yes.
Just plugging that for you, Martha.
Yes, I know, and we actually have a partnership with them, and it's growing, and it's good. And the last thing I wanted to touch on is just the bylaws and the membership of the Housing Authority. A Housing Authority board may have up to 7 commissioners. As you know, 5 shall be of the governing body of Clackamas County as elected by the citizens. This is the language in the bylaws of Clackamas County. The first commissioner that is appointed, that's not elected, must be a resident who receives direct assistance from the authority, and that is what our resident commissioner. And then the second one, if this entity chose to have one, must live within the jurisdiction of the authority. And it really is common and a best practice to have an at-large position that the board can select, and often that person is someone with expertise. Maybe somebody that has deep development expertise, or whatever expertise that the current board felt like they would benefit from. this is something that I think every housing authority in the state of Oregon that has a governing governmental board like ours has. Washington County and my peers in Washington County and Eugene both have an at-large member.
Does Multnomah County?
Multnomah County doesn't have a board that is made up of an elected body. They have a different kind of board, which is also an option. Some governments want the housing authority to be one step removed from their elected body. So the actually Home Forward, the housing authority that used to be the Housing Authority of Portland, they serve all of Multnomah County. And they have a board member that's nominated by the city of Gresham, and one that's from Portland, and then Multnomah County has a couple, so that all of the cities across the county feel represented. And that's actually why Portland, the Housing Authority of Portland changed its name, is because Gresham did not feel represented. I was in those meetings. So, and I think it's a really good thing. They all, I mean, they represent Troutdale and Wood Village and Gresham and all of those areas. They are not a Portland entity.
Right.
So that is another model that I think all but 4 housing authorities in the state of Oregon have adopted. We're one of only 4 that have the governmental model for a board.
Is that, have you finished your presentation?
I am done, yes, I'm
Okay.
ready for questions.
And I'm going to open it up to questions, and Ann Leenstrom, if you have a comment or a question, I'll get to you after Paul Savas.
Yeah, so years back, not that long ago, when I found out that our housing authority was, 80 years old? Was that what it was?
I think so.
About 2018, I think, whatever the year that was, when we celebrated over there at Hillside.
Yeah.
Yeah. And I went back, and this is also around the same time I was encouraging to look at our special districts as giving them some autonomy and and I've always been a stickler for this, having the board recognize that we're wearing a different hat. And Gary and staff were all doing a better job of trying to do that. And the housing authorities is a different animal. It's not quite really a district, but it's under, you're right, under 456. So when I went back a few years ago and read 456, and I'm reading it again today, just kind of perusing it, it strikes me in that conversation we were having with supportive housing services as far as the role here by design, that as I read it, again, I haven't gone through it all and word by word, is that it's really about housing, the structure, the provision of the housing. It's not about the supportive service piece, right? And so, but the measure seems to infer that the housing authority now step into that role. And I'm just kind of wondering if it's congruent with the law, and if it's not, then how we make sure that in that whole IGA thing, looking back at Mr. Madcore in the back of the room, that we are, we're meeting the law. And then, so with that said, and also getting back to the board, including, in this case, Commissioner Leenstra, for example, that we are actually putting that hat on in a very deliberate way and thinking, like a districts do, is that they are single purpose, which is getting your earlier question, why was it done that way? I think that single purpose, single focus allows people to do their job more effectively without distraction, without political influence or bias. It is really saying, we are here to do this job. In this case, housing, or water, for example. They all have their designations. And I think that is that's what gets lost with the county service district model, is having that separation. And I do know that if talking to other commissioners around the country, or here in Oregon, some of them do is they say that we'll meet at a different place, not the same place, right? So instead of the county commission meeting here, for example, maybe the county commission might meet at a facility owned by the housing authority. And that gives them that separation and realize we're putting a different hat on. So I think if we can get to that point at some point in time, and we can practice that, I would certainly like to entertain bringing in that expertise when it comes to the financing of that. I think that would be a huge asset, because that's something that none of us are probably ever going to likely have here, the 5 of us. or the six of us in this case, have that expertise into how the financing of housing facilities, somewhat to where like, who was the last gentleman that worked for us? Stephen. Stephen, he had that level of expertise. And it's, and the new person now is, what's her name? Devin, so she's our new, but someone on the board would be a staff person. In this case, it would be someone with that level of expertise. But I'd like to have that, but I think we got some groundwork to do in the sense of getting the supportive housing services, this role, the staff, all of it, to think and have that autonomy.
Yes, and I agree with those statements, and we used to, when I actually worked for Home Forward, because they had moving to work flexibility, they had a very large service arm as well as a very large contract administration arm, as do most housing authorities. And all that the voucher program is thousands of contracts with landlords, so we're actually very experienced at contract administration. Not necessarily at service provision, nor do we intend to be. That supportive housing is just about contract administration, which I have many years of experience at, and hope that our housing authority can as well. We used to have meetings every year in Gresham and at the various cities, and I would welcome that opportunity and to go to different communities and have residents attend. That's very common with housing authorities across the country. I've worked at 4 different ones, and they all did that. And it's really a great way for the board to connect with the residents and for you to hear from them. And the final thing that I would just throw out there, since you brought it up, Commissioner Savas, is that the way Washington County is dealing with the fact that the funding for the measure is coming into the county is they already had a structure in place that really helps them with that challenge, in that the housing authority is a piece of a housing like division or department, and they're just part of it. So like the continuum of care and the supportive housing measure and the Metro Housing Bond, it funnels into the housing department that is not in the housing authority. So they meet separately. There's 2 budget processes, there's 2 boards. The only thing that's the same is the head, my peer there, oversees all of it, but with different teams. But it really helps. It helps him because he can ensure the values and the principles about housing delivery and the way that we, interact with our housing providers and do housing contracts are in alignment and consistent with the will of the board.
Yeah, and I think thanks, Jill, for that, because I think that really says and confirms, the thoughts. And my observation is I don't think people understand those different roles and how we have to be integrated. They shouldn't be looking at it as something that might be wrong or not right or fair, that it should be here or there. I don't think they understand those nuances in the law. So I think there has to be that partnership, like you just stated, between the 2.
And alignment.
Yeah.
Okay, Ann Linstra, do you have any questions or comments?
Not really, other than I like the direction that we're going in. Trying to serve the most vulnerable and giving them everything they need. Coming from my own background, I would not be housed if it weren't for the housing program, the 30%. And for me, I'm always grateful for that. There are those who resent being in our position, but most of us are very thankful that that's what we have gotten out of this program.
Thank you for that. It's very encouraging. Any other comments for the presenters today? Mark?
Chair Smith, I got one question. The Rosemont Supportive Housing Project built under HUD guidelines that we saw last month very nice project, I think 280 units. If we never built another project like that, and instead we provided zoning that allowed private builders to build efficiency apartments, and then focused on housing choice vouchers, what would be the result of that, in your opinion? Would we improve our situation or make it more difficult?
I think it would improve our situation, but I do think we need to do both, just because there's such a huge deficit of units right now. There's a giant deficit of smaller units in Clackamas County. So we definitely need the smaller units. We have single people that can't find a one-bedroom, so they're having to lease larger units, which is really expensive. Like I said, I'm a huge fan of the Housing Choice Voucher Program. It's my favorite program as long as there's units. And Pedcore that developed Rosewood Station is a private developer. I mean, they are not a nonprofit. They're a private for-profit developer, and that's what they do all over the country. So, you know, what we offered them brought them here, and they're 100%, 60% units. So if you look on here at the rents, and they've got, you know, various sizes of units, so they're really serving people that need it in Clackamas County, but our most low-income people can't afford to live there.
Right.
So we have to do kind of a little bit of everything.
One thing that was encouraging a couple weeks ago when we had the town hall with Senator Merkley was he talked about efficiency units, and he talked about the need to change HUD regulations. And I thought that was very encouraging. Are you tracking on that?
I did hear about that.
And do you kind of keep up on progress there?
I do. I am actually the president of the Association of Housing Authorities, and we're really in tune with legislation. And that is something that we're discussing at our next meeting.
Oh, good, because I think that is a very good course to pursue. If we
Less
can,
expensive.
Yes,
It was all about
exactly.
less expensive development.
Less expensive and more units.
Yes.
Okay.
And hopefully quicker.
And quicker, yeah.
Quicker would be good.
Okay,
A lot
thank
of the
you.
reasons it takes so long is all of the federal requirements that are in our way.
That's right. That's very true. Any other comments for our presenters today?
Well, we got our money's worth out of them. We worked them hard today.
Yeah.
Got 3 sessions out of them, so thank you so much.
Thank you for being here.
Absolutely, happy to support. And I do want to, I didn't realize that Jill was the president of the State Housing Authority, because I actually just got elected in as the president of our Association of Community Mental Health Programs, our state association as well.
Nice.
So Clackamas
We're
is
in high esteem.
represented. You know,
position,
sometimes it's a
yeah.
blessing and a curse, so.
Well,
yeah.
you know, we bow to your expertise in
So-
that area. We're well-served, and thank you for that.
Thank you all.
Thank you very much.
Thanks for the presentation today, very, very informative. Gary?
Excellent. That is it for the day, Chair Smith.
Well, we will adjourn the meeting for today. Thank you for everybody participating.
Excellent.